Okay, perfect.
Dr. Greenhill, thank you so much for joining me today for Precision Medicine Awareness Month during our speaker series. And we've got you on today. We're going to speak about artificial intelligence integration in precision medicine. And I'm going to be honest, I don't really understand the AI in precision medicine. So I'm really looking forward to hearing you discuss this.
Well, it's a new field, so it's normal to not understand, but I'm glad you're curious, and I hope many others are, because it's hard to cover that topic in a conference, let alone in a short session. But the idea behind today is to just give people a sense of what to expect, because this field is rapidly changing, and following it is important because it will reveal results, or it's already revealing results very soon that literally can be life-saving. So I've prepared a little presentation, and I'm happy to have people reach out and follow up with questions because we're part of a community that is building around this area, and the community needs to include everyone. And by that, I mean people affected by the illness that can be solved with precision medicine, but also policy and decision makers and researchers and clinicians, because this is a rapidly evolving field and all of us are needed in order to make sense of it and decide what is the right way to implement that in our day-to-day healthcare system. So as a doctor, I always have to put up disclaimers. I lead a technology company called Care Team. I'm on several boards. I teach at UBC. And importantly, participate in supporting cancer fundamental research, so finding out what kind of solutions are most promising in the space. But part of why you've asked me to speak here is because of my work in AI. These are some of the resources that I often recommend. The book in the middle, AI in Clinical Medicine, I helped co-edit with over 100 of the best physicians across the country. And these are some other really good accessible reads for people who want to know more about what is happening in the field. The other reason why I'm here is because the future is already here, it's just not evenly distributed. One of my favorite quotes. And what that means is in my clinical practice, I see a massive growing gap between what's possible and what happens for most patients. When I was training, I thought I'd be one of those Star Trek physicians with a little tricorder, and this is what the Star Trek dashboard looked like that they shared in the series, with genetic material on the left and all kinds of real-time data around the patient and what's happening. The reality of my clinical practice is a waiting room like this one, and that hasn't changed much in the last 20 years. And so, in addition to all of this, it's difficult to find a family physician, which is the entry point to the healthcare system. And then we have these kind of graphics for patients with cancer, which makes it seem like an orderly process from having a symptom to getting diagnosed to being treated to having follow up. But the reality for most of my patients is not that straightforward. And this is a map that BC Cancer did based on real patients and their journey. And if it looks a bit like a snakes and ladders exercise, is because it is. You need to figure out where to go next, who are the right people to engage with, what are the instructions exactly, and it feels very chaotic and unpredictable. And in addition to that existing pathway, we're now throwing in new tools like precision medicine that change those conversations dramatically. And so it becomes even further uncharted territory. But things are not dire, and part of my objective today is to give you a sense of exactly what is happening, as opposed to the hype you see on the news, or people saying, well, we can't afford it and this is not possible. And this is one of my other favorite quotes by Albert Einstein: if you can't explain it simply, then it means you don't understand it well enough. So I will attempt in the next 15 minutes to give you a strong understanding of both precision medicine, where it is right now, and how AI fits into it. First of all, the World Economic Forum predicted this moment in time. And they talked about how there are four industrial revolutions. This is the industrial revolutions that got us the trains, then electricity, then computers, and we're now in the fourth wave. And the fourth wave is about convergence between all of these different innovations. And so you're going to see more genomics and devices and materials around us become smarter so that we don't have to put on blood pressure monitors on someone, but literally the jacket that they're wearing will transmit all kinds of information about their health. And adding in the genomics. And as everything is converging, right now is, if we had to put it simply, it's in the state of either extreme hype of this is coming to you tomorrow, don't have to do the following things, you can just use these devices and everything's going to be okay, versus these things are not going to work. I tried it and it's really primitive. Some people say it's not real, some people say it's moving fast. The reality is that any type of new innovation has the cycle of adoption. When it's first introduced, people have this idea of like, wow, this is going to be amazing and it's going to work for everything. And then you have this sort of a realization that, wait a second, between the idea or the invention, we need to figure out how do we make sure that it's safe for people to use, that it actually reliably works. What are the right usages for this? And if you think that this is a new problem, when the potato was introduced to Europe, everybody thought that that was going to be the miracle drug that's going to cure everything. And so we now know that potatoes are tasty, but certainly not miraculously curative. But at the time, the potato went through that wave of adoption. And that's the same thing that's happening right now with AI and genomics. And so the next question people say is, where are we right now on this? Well, it depends on what you're talking about. For some things like AI, we're probably at the slope of enlightenment. It's starting to be more and more available. We understand better how it works. It costs less, so more people can access it. For other things, we are still at the peak of inflated expectations, such as precision medicine. Some of the claims being made out there in the headlines, when you read the study, it will actually tell you that this is a very early stage in lab type of discovery, or we've tested that on mice. And so before this actually gets available to humans, it's going to take a while. The good news is that AI is allowing us to go even faster on these paths. And so research that used to take years can now take months, because you can ask the AI to predict which type of proteins and genes are more likely to succeed, and you can choose and focus on them. And so it's a great collaboration between the two that it's accelerating this entire cycle. In the meantime, you still have the challenges of the healthcare system. This is one of my favorite little cartoons because everyone's finding it very hard to do things. But when you come in with a new idea in a very busy healthcare system that is very tired from having had COVID in the last few years, everyone's overwhelmed. There's so many new things. The reaction tends to be, yeah, right, no thanks. That said, is the good news about that is the adoption tends to follow a cycle where some people have the curiosity capacity to try it and then figure out how do we actually take it across the chasm into making it mainstream. And my personal issue with this, if you remember the first few slides with the gap, is that there are centers that are already practicing precision medicine, but they are in a few places and only affordable to some people who have money. And crossing that gap, making that transition faster is something that is really, really important, because the usual adoption curve in healthcare is this. Instead of having sort of early majority and then enthusiastic adoption, is we have resistance along the way of saying like, oh, I've always done it this way. This has always worked for me. And we need to break through that psychological resistance. And I really believe that patients are going to be an important decision maker in that conversation, and they're going to push for the right changes to happen. And policymakers can actually make changes as well, making it possible to make it easier to adopt, making it easier to regulate a lot of these technologies and innovations to make sure that they're safe and affordable for everyone. So in the next few minutes, let me give you a quick sense of what AI is. Most people think it's very complicated, and it's something where we put data in and some sort of algorithmic magic makes it into an output that is special insight. And it does feel like that, especially if you're using ChatGPT. You do something and then poof, seconds later, you get something else. The reality is that AI is a combination of probabilities and formulas. So very similar to statistics in many ways. And the more advanced it is, the more it can actually think through the different options and present the one that is more likely to be the one that you want. So even ChatGPT, even when produces nice results, will ask you at the end, is that what you wanted? And when you say yes or no, it learns from that exchange. And that's why it's called learning systems. It's machine learning. It's trying to evolve based on that feedback, but it still is a series of action and then reaction and then the learning loop. There are many different names for the very different components of AI, but it's important to understand that essentially it's a continuum of how much does the machine does on its own versus how much does a human need to help. And so data science, very much on the human side. We've used calculators and spreadsheets for a long time, but they are machines that did exactly what they were told. People then said, like, wait a second, we can put in all kinds of formulas and we can introduce machine learning into the system where they're a little bit more independent, so it goes over to the side of machine. Then artificial intelligence came in, which is a machine that learns more independently. Then came in deep learning, which is, I don't quite know exactly how the machine learned because I didn't specifically tell it how to learn, but I said, learn from the feedback. And that's what is happening with deep learning. There's augmented intelligence, which means the machine's output is shown to a human. At the end of an x-ray, for example, the radiologist will say yes or no, and that provides the feedback loop. And so you are, in fact, doing a form of augmented intelligence when you're using ChatGPT because it gives you an output you can use, and hopefully you give it feedback on was that useful or not. And then the large language models are sort of even more advanced, where the output is so good that most humans are like, yep, this works for me. I don't need to do much more. But they were the result of years of investment. And so the important thing on this diagram is when you hear these terms used in a conversation, pause whoever you're talking with and ask them to explain exactly what do they mean in that context. A lot of people will use AI as a blanket umbrella term when in fact they're using a subset of these types of solutions, or they are just hyping it up and they have a simple machine learning, if this then that type of chatbot, because it's just trendy to use the term AI. And so I would invite all of you to specifically ask, well, hey, this is exciting. You're using AI. Can you tell me more about exactly what it does so that you can start learning through these conversations and you can see what is real and what isn't? The back to precision medicine. And I know you're going to have a series of these talks that I would encourage you to watch, but just a quick definition of it is precision medicine, in particular, applied to cancer treatment. It's about choosing the right treatment for the individual patient. And so if you look at the graphic on the right, is we right now have to make an assumption. It's not that we're trying to use one treatment for all, but that's all the options that we have, because something has been researched across a number of people, have been shown to be safe for all of them, but oftentimes we don't know who's going to benefit the most. And so some people take it and they benefit, some people it's neutral, and for some people, unfortunately, they get side effects and things that we didn't intend with the treatment. And that's all that we can do right now within what's available to us. With precision medicine, the lower slide applies, which is we can start tailoring a combination of factors. So the person's own genetics, so what do they inherit from mom and dad? Their own lifestyle choices, as well as the actual tumor characteristics and the microenvironment of the tumor combined started giving us a sense of like, this treatment's more likely to work for that type of patient and less likely to work for another one. And that has now successfully been applied to breast cancer, colorectal cancer, and in my life of practice, in the last 20 years, we went from having a diagnosis that was devastating and was likely to end someone's life to something that, if caught early, is literally a bit of a pause. We do need to do treatments, but then people can have a normal life afterwards and a normal life expectancy. And that is just magic. We keep criticizing the healthcare system for not being good, but this is incredible. And we have achieved that within the framework of our health and research environments. Um, So this is the actual sort of walkthrough is you have three different patients, let's say with colon cancer, who receive that personalized treatment. Is first they are analyzed and examined, then the biomarkers looked for, and so if they have a certain biomarker, certain treatment is suggested or provided, and then at the end of the day, our expectation is all three would have a positive effect where they get the maximum benefit with the least amount of side effects. So the challenge within this and why it's not a fait accompli or it's a done deal is because the human genome is actually massive. Each cell contains 3 billion nucleotide pairs. And so they're doubled, and you can argue about do you count each one of them, which makes it 6 billion, or do you count one individual side, which is 3 billion? But in any case, we're not arguing about the fact that it is billion, and there's so many. And it's expensive to look through them, it's complicated to look through them. And in type of cancer, what you want to do is check as many of these cells as possible because cancer is a period of uncontrolled growth where a lot of mistakes happen when a copy is made. And so the parent cell and it splits into two, and the two clones of that are actually not clones. They contain different mistakes, and that's where it's high growth, high speed, high rate of errors. And so the challenge we have applying genomics to that is we need to figure out which ones of those 3 billion nucleotide pairs are causing issues, and then figure out how do you actually fix it, neutralize it, identify it, so that you can target it more effectively with a treatment and say only these cells, but don't touch the healthy ones. Or we can actually potentially delete an element that has gone rogue and say we're going to just make it healthy again. And so it's very, very challenging. To give you an idea of how challenging it is in addition to the genome, which is what we just talked about, there are different levels at which we can act. We can act at the transcriptome, which is the moment where the genome gets copied. We can act at the proteome, which is the moment at which the genome expresses proteins that then float in our body. And then we can act at the metabolome, which is how these proteins are being used, and the microbiome. So at every one of those steps, there's tremendous amount of effort going into research to try and figure out which of those moments in time is both the most effective, the fastest way to get to it, um, will be least disruptive for the patient. And so the answer is we don't know. If you remember that curve of expectations is everyone is hyped up about the potential of each one of those. And there's a race, and it's a good kind of a race to figure out which one, if not which ones in combination, would be the right ways to treat patients. Um, but we are in the very early days, and we need to be cautious to not overpromise and deliver. This is a fascinating little effort from CBC Marketplace from Charlie's Agro, which has a twin sister. And one of the experiments that they ran is they sent their samples, both of them identical twins, so their DNA should be absolutely identical. They sent them to 5 companies claiming to do ancestry research online. And so the companies are listed on the left. The result is on the right. This is the one from 23andMe, but it was exactly the same from the other companies, which is the two twin sisters had some things in common, so that 37, 38% was Italian. He talked about being Eastern European in about the same percentages, but not exactly. And then on the right-hand side, you can see how the test got it wrong. And the question then is like, well, how could this happen? Well, these companies take about 70,000 or 700,000 of your DNA bases, and they take a guess. If you remember machine learning, it's all about the machine trying to figure it out and get feedback of did I get it right? Unfortunately, right now, a lot of people are saying we're sure that this happens. And I know patients who then go on and talk about are we really related and try and find lost relatives in places that don't exist. But it's really important to have that understanding that even for something as simple as ancestry, we're not quite there yet. And this is why precision medicine takes so much effort and costs so much, is because it's very promising, but we need to get it right. Another quick example is red hair. It's a very common sort of example in high school. Many people have seen, in order for you to have red hair, mom and dad have to have had gene for red hair. Sometimes they are redheaded themselves, but sometimes they're not. And then, surprise, your child has red hair. It's because it's a silent gene if you have darker hair. And so, one set of kids can end up having red hair, as is illustrated here, while other kids are carriers. So they transmit the red genes to their generation, and some of the kids will end up not having it at all. So we had done progress, we identified it, the MC1R gene found on chromosome 16. And then researchers recently discovered that actually, wait a second, why do some people who have both them have red hair don't end up with a kid with a red hair, or the other way around? And the gene's there, but why is it not activated? And we now know that there's up to 200 other genes that influence whether that gene goes live or stays dormant. And sometimes it just gets deleted when the baby is created. And so it's way more complicated than we thought back in high school. So the major opportunities around all of this is we can apply omics or genomics at precision medicine at every step. We can identify people who might be at high risk and help them lower their risk. So this is the genetic testing of, if your relatives have had breast cancer or colon cancer, how worried should you be? And if you are to be very worried, these are all the steps you can take to prevent this from being part of your medical history. You can detect cancers early. You can diagnose cancers very specifically and say this is the type of cancer that you're having that's going to respond or not to a new type of treatment. You can choose which treatments are the best, and then you can evaluate is the treatment working or not. And I on purpose did not put numbers in front of these bullet points because all of these are important and all of these are being researched. And progress in every step means people's lives saved. The challenges, and there are many more than what I've listed, but one of the bigger ones are equal access. And so a lot of these new treatments are for now very expensive, and it can only go to people who have the money or fundraise successfully. And that as a society is just heartbreaking because everyone deserves a chance. We need to make sure that a lot of these studies have the robust evidence that it works and it's safe. We need to help physicians to interpret a lot of this data and be surrounded by people like genetic counselors because they help you understand the probability that yes, you have the gene, but how likely is it to actually cause trouble? And we need to empower the patients and educate the patients as well to receive this information so that they can make a decision. So the decision is not made the way some people do in my office is, Dr. Greenhill, what would you do? And they're like, well, that's my decision. Let me help you make one that makes sense for you. And then beyond genomics and precision medicine, there's so many other factors that matter, whether it's cultural or religious, context, societal. And so all of those are important to factor in because you can't just deal with the cancer diagnosis or the cancer probability. You need to deal with the whole person and where they fit into their family and their society. So the chapter that I wrote in that book that I was mentioning is about AI-enabled consumer-facing health technology. Nowadays, they're starting to shorten that by saying patient-facing health technology. And technically, everything is patient-facing. This is the one that is directly available to patients to purchase themselves without the help of a physician. I thought it was really important for my colleagues to know what's out there and what the trends are. And this is a little diagram we put together to basically say is that it's a flywheel of more and more tools being available directly to the public. And why is because there's funding. It's easier than ever to create some of these tools. There's a lot of unmet needs. I know we were joking earlier about how people are going to use their iPhone for their doctor, but it's because they don't have access to a family physician and the system is confusing. And so using these tools allows you to have an easier journey. And then more and more patients want these kind of tools. They want more power, they want more choice. And so all of those factors create an accelerated curve and do-it-yourself healthcare, which is both good and I welcome it, but also concerning because it has to be done right. And so many of these tools don't have the right of protections because they're deemed to be consumer level. And we have those protections for medical tools, but just legislation is not there yet and should be there to protect people from being taken advantage of or being given tools that are not safe. What is being used for is any of the above is health and wellness and prevention. It's symptom detection and diagnosis of disease. You have more apps to essentially take a picture of your mole and tell you is it cancerous or not. And if it says too many moles of cancerous, that's one set of problems because then you have to go see a dermatologist. It increases costs to society through that. But if it actually misses, that's even more heartbreaking. It tells you that something's okay that it isn't. And so, out of the myriad of apps, just be careful to choose the ones that have scientific backing as opposed to the claim of wanting to do something out of good intentions, but no actual science behind it. You can do symptom tracking and monitoring of the treatment. You can do self treatment of the disease. And so, a lot of the mental health type of technology. So, if when you have cancer, it's obviously very anxiety provoking, and getting support is really important. And then you can participate in research. So there's more and more calls from various apps and devices using AI to say, bypass the research establishment, just sign up here. I'm going to start doing all kinds of experiments. And people have choices, and those are good choices to have. But it's just important to understand that within that, you need to monitor issues. And so one of them is informed consent. Do you clearly understand what is being proposed? Veracity. So a lot of people will put on a headline from a Harvard Medical School study that has pretty much nothing to do with what they do. And so just because it looks scientific doesn't mean that it is. About at least two-thirds of the apps with AI in the App Store don't have a terms of use or privacy policy, or if they do, it's just a generic short one pager that doesn't explain what they're going to do with the data. There's no clarity on pricing, so people invest and put in a lot of information and then end up having to pay a lot to maintain the account. The technology organization sort of goes live, doesn't get funding, doesn't continue, so you lose all of your data and or the treatments that you're accessing. They're doing research that's unregulated and selling your data to someone who's doing research, which is obviously not okay. There's usability issues, there's safety issues, your information gets fragmented, so there's no way of extracting some of that and providing it to the clinical teams that are doing the same research. And then just an increased burden on the healthcare system if there's a lot of false positives. And so if these apps say like, hey, you should also check out this symptom, and it ends up being unnecessary. I do spend a lot of time telling patients why, even though their entire family has had cancer, we shouldn't have to screen them constantly, that there's research as to how often you need to do screening, because it's safe to wait between screening moments. We know based on research that X number of months or years between is okay, because if we say that you're fine today, you're not likely to develop a problem faster. And then finally, that whole effect on diversity, equity, and inclusion. A couple of practical things that are exciting. The Canadian Cancer Clinical Trials Network has an AI precision oncology trial finder. One of the challenges is when you get diagnosed with cancer is you want to discover, are there any options for me to do research with any of the latest ones, that treatments that are available, especially if your cancer is advanced, that there's not many proven options. Patients get very desperate to try anything. And so going through all of these trials and the requirements is usually a lot of work. There's a team here who's put together an algorithm that allows you to quickly discover, based on what cancer you have, is that a good option for you or not? And clearly, you can search it whether you're a patient, but it's also a tool that physicians can use, because even though I have the medical knowledge to analyze a lot of these studies, it cuts down in the time of finding the right study. And then there's a Canadian company that I've helped advise called Heal Mary. They've done the same, but internationally. And so you can actually sort of search a condition and disease, and sort of they've made it into they've used the AI to make it accessible for patients, so it's easier to understand what is meant and articulate what you're looking for. And you can see who in the world is doing research in the area, and see if you're eligible for that. Because it is a huge problem, cancer researchers wanting to do clinical trials have to find someone who has the type of cancer that they're researching at the right stage in order to add them to the study. So it's a bit of a right now a challenge of matching on both sides, and solutions like these that use AI allow you to figure out the solution faster as to where is the right spot for you, and find more patients who are eligible for these new options. The area in which I spend a lot of time is figuring out, now that these treatments exist and they're proven, how can we get them to you fastest? And how can we take this whole sort of a golden path in the middle of, if you know how the system works and you're in the best center in the world to be treated, is there's a set of steps that needs to happen. If you remember that complicated cancer journey, is I'm trying to organize it into something that's easier to follow, where from your symptom to the diagnosis to the treatment, there are clear instructions at every step, and you can be supported by family and loved ones. And your overall team, the family physician, the practicing sort of pharmacists and therapists, can be updated and informed. And so creating that allows you to not make it just easier for the patient, but it allows you to collect data that can be then added to the genomics interpretation and the real world evidence as to whether or not these kind of treatments work, and get them to as many patients as possible. What causes genetic changes? Just a reminder that in the meantime, the National Cancer Institute has published these, and there's many other versions available online. But essentially, it's a combination between your genetics, but you do not have to be a victim of what you inherited, because there's a number of other things you can do to monitor, prevent, detect cancer. It's about exposure to UV radiation or too much sun. It's about chemicals that you put on your skin or you ingest in your food. So processed food has been shown to be a real problem. It's about viruses, smoking, and alcohol. Actually, they should be adding in there. And it's just about sometimes cells start dividing. And so the important thing on this is prevention really makes a difference. While we're all very passionate about detecting and treating cancer, is if I can, through my work, help prevent, I'm always happiest. And I really like this book by Dr. Turner. She's a PhD and got cancer. And she said, instead of interviewing everybody who has died with cancer, why don't I go and interview everyone who has survived with cancer? And what's interesting about her book is she talks about radical remission as patients who were not supposed to survive but did. And she comes in with a scientist lens. There's a lot of these kind of stories of I refused all treatments and I was okay. What her book essentially says is that no matter what options are given to you in terms of traditional or precision medicine, there are certain fundamentals that matter. And a lot of the lessons learned are not a surprise for us in the healthcare space, but they are feeling connected, feeling supported, letting go of a lot of the emotions of shame, blame, anger at being diagnosed or having issues with cancer. And so practicing that in addition to your treatments can definitely help. And so it's all about combining that wisdom to your existing journey if you're facing a cancer diagnosis or have overcome one. And so these are some of my prescriptions to things you can read. Dr. Topol has written a number of really great books, including The Patient Will See You Now, is a changing paradigm around how it's not the doctor will see you now. Peter Attia has combined a lot of the research into a practical book of how can you use the best proven methods to prevent and live longer, not just for cancer. And then, as I mentioned, Dr. Turner's book. Happy to take questions, and hopefully this was useful and interesting.
It was definitely interesting and absolutely useful. Um, I will ask a few questions, and then if anybody is watching, once the recording goes up and has questions, then I will invite them to email me. Or I know you also put up a slide with your email, so if you're open to receiving those questions as well. Um,
Questions are awesome. Please do.
I really appreciated how you showed those two examples of how AI is being used now in precision medicine. So with the 3CTN, with the precision oncology trial finder, and then with Heal Mary. Um, are there other ways where we're seeing AI in practice right now in Canada?
Yeah, and I didn't want to sort of overwhelm people who are not scientific because a lot of it is sort of, if you think about that duck that looks quiet on top and is furiously swimming underneath the water, is at
Mhm.
every step of the scientific journey, AI plays a role. One of the most important ones is just finding articles. Every month, literally hundreds of thousands of articles are being published in the literature, and keeping track of that is very complicated for people who do research at every step of that journey. And so AI is being used to triage through a lot of the things published in a more effective way and give you the ones that you're supposed to read. It's not good enough anymore to do a search because the keyword search or the author search reveal yields tens of thousands of articles, and it's just not practical. And so using AI to find and summarize some of that is really an enabler. The other one is around sort of trying to understand which ones of the 3 billion
Mhm.
pairs we should probably go after. There's a number of AI models that essentially, instead of testing these ideas in the lab, you can test them in the artificial environment of the AI software that allows you to imagine how does that nucleotide sequence fold in a new protein, and is that protein likely to be the right one to do more research on. And so it takes years away from the normal lab process. And that is very, very exciting. And then once you develop some of these innovations, you can actually do 3D printed models of tissue, um, where you can test a lot of that on cancer cells that are grown into a sample that's robust enough, that includes even blood vessels in it, which is just fascinating, like 3D bioprinted tissue. It sounds like science fiction, but it's already possible, where you can test some of those new treatments without harming mice or humans. And so at every step, people are using AI to essentially do several things: is accelerate, um, ask questions that just couldn't be asked before at that step. So moving things a step ahead of where they would have been otherwise, and collaborating with the AI scientists on how can we just combine the lab medicine to some of these new opportunities and innovations.
I'm glad that you brought that up because I was going to ask a question. You showed the slide with with the 3 billion nucleotide acids, and then how, you know, is it 3 billion or is it 6 billion? And then you also showed that different slide with the proteins and the mitochondria and the microbiome. So there's all these different levels, and you know, it's great to hear how scientists and researchers are using AI to help them go through all that information, because if we were just doing it on our own, it would take so much longer to do that. But you did bring up a really interesting point about prevention. And is there a role for AI in prevention?
Well, I mean, for sure, one of the ways I think AI is going to come up with is right now there's a lot of fake news, and it's really easy for anyone to become a broadcaster of something that
Mhm.
takes time to figure out is it true or not. And a lot of the social media platforms have a hard time monitoring that. And I see a lot of patients be taken by, again, in desperation by stories of if you only try these kind of supplements or these remedies or this approach, you're going to feel better. I think we're going to start surfacing a lot faster some of these and removing their credibility sources and calling them for what they are, which is a opportunistic type of taking advantage of people who don't have other options. We're going to do the reverse as well, as there's a lot of wisdom in some of these Facebook groups and patient online communities where people share their lived experience, but they also share their real world evidence that is right now not being captured. I'm very excited about using AI to shift through some of that available content that people are sharing with obviously permission. It's online, and just listening to the weak signals, to the patterns within that, and starting to identify more. Um, I have a collection of books, as you gathered by now. I read a lot. Is in my house that is, and she said, "I didn't know." And so it's nurses, doctors, psychologists, decision makers who are themselves affected by an illness and write a book afterwards, or their loved ones, and they say, wow, I now understand so much better what I was going through. And all of us in medicine who've had children had this moment of experience where the advice we used to give parents before and after is just completely different. And so lived experience is really important. And right now, all of the efforts have been traditionally focused on experts. But discovering more through AI around real world patterns, understanding more about we send someone home with treatment for cancer. How does what they eat and their level of activity and their level of social support make a difference? Because there was an interesting study where you mentioned biome and genome is just because you have the blueprint for the genomic, it doesn't mean that that gene is activated to secrete protein. And so in San Francisco, they took monks that meditate, obviously, or Buddhist monks all the time. They showed them a couple of hours of movies about war, devastation, destruction, sort of negative news cycle. And then they checked their protein expression, which had completely shifted. And so if 2 hours is enough to shift someone who sort of literally meditates all day long into a state of stress, I wonder what our news cycle is doing to us. And so a
Hmm.
lot of that is still there to be discovered. And with the AI, it's either too expensive or too complicated, or will take too long without AI. But with AI, we have a chance of actually understanding better. The triad in health is always the diseased organ, the host or the patient, and then its environment. We can understand more how does the environment matter, whether forest fires and the pollution in our air make an impact on the success or the lack of success of certain treatments. And right now, we just don't know.
That is so interesting. I'm so looking forward to seeing more, I guess, data or studies on that. That is so interesting. I guess just maybe one last question. You talked about how patients have to become decision makers as well. And can you just maybe talk a little bit more to that point? And what advice do you have for patients so that they can be that decision maker, so that they can make not only the decisions for themselves in the treatment, but help in restructuring, maybe that's too big of a word, but in the restructuring of our healthcare system.
Well, it's a big word, but it's also how the reality of how things happen. And so patient advocacy or pushing for change is really important. And I see a pattern where when you're diagnosed with cancer, you go see the mighty specialist at the cancer center, and you're so afraid of offending them somehow. And they're so authoritative and they're so fast, they in and out, and like, do you have any questions? That as a family doctor, they come back to me and they're like, I didn't understand a number of things, or I'm wondering if this is the right option, and I read up on it, and this is what they do in whatever country people come from. Like if it's Europe, they'll quote a study from their homeland, or if it's Asia, they'll or Latin America, they'll go back and say, well, in Brazil, we're doing it this way. And so these are all very important questions to ask, especially to the specialist, because as a family physician, I can research it and weigh in, but specialists are often connected in networks across. and they are more aware of the options and what exists, and asking those questions is absolutely okay. And if it's not okay, then you should be worried about the kind of physician you have, because that means that it's more of an old school approach, and they may not be the right practitioner to treat you, or they're part of the epidemic of burnout and just people who are not doing well in their own clinical practice. And so a good physician welcomes questions that are presented reasonably. So it's not about like Mexican healing music might cure my cancer, I refuse treatment, but it's about, hey, here's a article, study, research point. Is there, or just an open-ended question of, are there other options? What else could I be trying right now? How else should I be thinking about it? And those are very important from a patient perspective to raise. The other thing that people don't understand is we've sort of used the terms patient centered for the longest time. And I'm trying to push for patient first or patient empowered. And the difference between that is patient centered is like talking about the patient all the time, but without asking them what their choices are. And we know that the goals of care are really important. There was physician in Manitoba who's put together the patient dignity questionnaire. And out of all of the questions that in the study, the most important one is, what do I need to know about you as a human to provide the best care possible today? And in cancer centers, that question alone shifts things, because of say, instead of saying 68-year-old with stage 2 liver carcinoma, you say, this is Jody who really wants to see her daughter graduate from high school, right? And it just shifts everyone's attention and effort in a completely different direction. And last but not least, the caregiver role cannot be underestimated. And no one calls themselves caregiver. This is a doctor medical system made term. Um, just because someone in your life has cancer, you don't suddenly stop being their mother, sister, best friend, and shift into this new volunteer assigned caregiver role. You still have that role, but you're there as a support team, and that support team is absolutely essential, because people with cancer diagnosis, it's overwhelming, it's scary, your brain shuts down. Once you're in treatment, especially, you get tired, and you need to have people around you who can step up and help you get motivated that yes, you can do this, but also on a practical level, bring in food, that drive you to appointments, sit with you while you're getting treatments. And we need to rethink our cancer care in that lens, and understand that even with precision medicine on board, that journey experience of the devastating moment in which suddenly your perception of who you are changes, because either you're told you have a risk for cancer or you have cancer, um, that moment should not be lived alone. We should be surrounded by others who can help us, and access to their experience of going through that illness, and their knowledge of who you are and helping you get through that illness. It's a long answer, but I'm very passionate about this.
Well, it was a wonderful answer, so we'll take it as long as it is. Dr. Greenhill, thank you so much. This was such a great, eye-opening, introductory discussion on the use of AI in precision medicine, but in healthcare as well. I appreciate your time, and thank you so much. And happy November, happy Precision Medicine Awareness Month.
I am excited that in 5 years, when we speak again, so much more is going to happen than what's happening right now. Thank you for hosting this and the invitation. And I'm happy to follow up with anyone who has questions.
Perfect. I for sure will have more questions, so we might have to have you back.
Happy to help. All right, take care. Bye bye.
Thank you so much. Bye.